In British Columbia, there are 6 types of paramedics that provide different levels of care depending on where you live and what your emergency healthcare need is.
As an emergency medical responder, I am licensed to administer basic life-saving emergency medical care.
EMRs typically work in rural and remote regions of the province. And during our 3 weeks of training, we learn how to apply cervical collars and spinal immobilization,
Patient handling, packaging and transporting skills, blood pressure by auscultation and palpitation, glucometer, emergency fracture immobilization,
soft tissue injury treatment, administration of automated external defibrillators, and airway management.
As a primary care paramedic, we are licensed to administer more advanced patient care than EMRs, having taken the same 3-week training and an additional 8 months. In our fast-paced training, we are endorsed to use extraglottic airway devices, medicine administration using IV, oral, subcutaneous, sublingual, intramuscular, inhalation, and nebulization routes. Administration and maintenance of IV lines using infusion pumps and devices endorsement, ECG acquisition, and initiation and maintenance of non-invasive positive pressure ventilation devices.
The majority of BC paramedics are PCPs, and we handle the brunt of 911 calls. Primary care paramedics also understand the anatomy and physiology of the body, which allows us to perform life-saving interventions through drug therapies. Some examples include epinephrine if you're having an allergic reaction, Ventolin if you're short of breath or having an asthma attack, nitroglycerin if you're having chest pain, gravel for nausea, and IV use to give you fluids for blood loss, diabetic shock, or TXA for severe bleeding after a major trauma.
As community paramedics, we are licensed at primary or advanced care paramedic license levels to provide non-emergency and scheduled care to patients as part of an integrated healthcare team. During additional 14 weeks of training, I've learned to provide community outreach and awareness. We offer a range of services to older patients living with chronic conditions such as diabetes, hypertension, heart failure, and COPD.
We offer fall prevention assessments to keep older patients safer in their homes through scheduled and unscheduled home visits. We're also trained in palliative care to support clients and their families.
As an advanced care paramedic, I specialize in advanced care of medical and trauma patients with a focus on advanced cardiac resuscitation. On top of my PCP training, I spent another 18 months adding the following to my scope of practice:
ECG rhythm interpretation, manual defibrillation and cardioversion, intraosseous placement and infusion, external jugular IV lines, surgical airways, chest decompression, gastric tube and suction, IV medications and infusion maintenance, end-tidal CO2 monitoring, IV colloid and crystalloid volume expanders, and the administration of the following drugs using the IV, oral, inhaled, nebulized, intranasal, endotracheal, intraosseous, and intramuscular routes of administration.
Paramedic specialists are advanced care and critical care paramedics who provide on-scene clinical and technical support for crews across the province.
We have over 500 hours of further training in regards to dispatch procedures, CBRN events, high-risk hazard events, mass casualty events, tactical events, either on real time on the street by working as a solo responder or through our communication centers. Of the 3 communication centers in BC, we currently are working out of the Vancouver Dispatch Center. Any type of medical advice that we can provide to crews, whether it be a medical support question in regards to treatment guidelines, or could it be medical advice on pathophysiology, we're at a phone call away for paramedics throughout the entire province.
Critical care paramedic is a paramedic that's reached basically the highest level of practice within British Columbia and Canada, honestly, that a paramedic can achieve. The primary focus for most critical care paramedics is to do interfacility transports, and essentially it's a mobile ICU unit that potentially and most often flies in the sky with helicopters, fixed-wing jets, turboprops, and also does ground interfacility transports. There is a role for 911 pre-hospital calls for critical care paramedics as well, but primarily the mandate is for doing interfacility transports.
My close to 6 years of training allows me to perform all the skills mentioned by the other paramedics, and in addition, I can perform arterial line placement with management and monitoring, management of central venous pressure monitoring, esophageal balloon manometry guided mechanical ventilation, interpretation of lab and radiological data, including X-rays, CT, and ultrasound imaging, ultrasound guided diagnostics, EEG guided anesthesia planning, administration of drug therapies on the direct orders of a designated transport advisor, mechanical ventilation, management of chest tubes, drainage systems, and gastric tubes.
We're considered critical care paramedics with a subspecialty in the populations of neonates, pediatrics, and high-risk obstetrics. We're actually the only paramedic-based team in the world that does all three patient populations. So we service everything from extreme prems, usually viability about 23 weeks gestation, all the way to pediatrics up to the age of 17, and then high-risk obstetrics. Our sickest of the sickest patients will be patients who are intubated, ventilated, sedated, with central lines, running inotropes possibly, maybe having chest tubes, or needing whatever support an ICU would do.